Okay, in this video we're going to look at hematology. Hematology is the branch of medicine focused on blood-forming organs like bone marrow and blood diseases, involving the study of blood cells, proteins, and clotting, diagnosing conditions like anemia, leukemia, hemophilia, and clotting disorders, and treating them through methods like chemotherapy, transfusions, and targeted therapies, with hematologists being specialists in this field. What it covers: blood components, red cells, white cells, platelets, hemoglobin and plasma proteins, blood forming organs, bone marrow, lymph nodes, spleen, and thymus. Functions: blood production, oxygen transport and clotting, hemostasis. Common conditions treated: anemia, iron deficiency, B12 deficiency, chronic diseases related to anemia, sickle cell anemia, cancers, leukemia, lymphoma, multiple myeloma, blood cancers, bleeding clotting disorders, hemophilia, thrombosis, blood clots, other infections affecting blood, disorders of the lymphatic system. How it's diagnosed and treated: diagnosis, blood tests, complete blood count, blood smears, biopsies, lab analysis, treatments, chemotherapy, immunotherapy, blood platelet transfusions, targeted therapies, anticoagulants, and managing underlying causes. Who practices it? Hematologists, physicians specializing in direct patient care for blood disorders, often combined with oncology, hematology oncology, hematopathologists, pathologists who study blood diseases in the lab, examining blood and tissue samples. So here we're going to look at hematology. It says spelled hematology in British, English, branch of medicine, study case, prognosis, treatment, and prevention of diseases related to blood. So this is here, and here we have another page. It's the same page, but this is like hidden. No, hematopoietic system, transfusion, medicine. Let's see. So here we have hematopoiesis, postnatal, vertebral and pelvis, sternum, ribs, lymph nodes, femur, cellularity, spleen, liver, yolk sac, bone marrow, tibial, ribs, lymph nodes. So we have bone marrow, spleen, and lymph nodes. Yeah, so basically those three. Do we have anything else? Bone marrow, lymph nodes, spleen. Oh yes, and the thymus. It's blood forming organ. So these are the blood cells: neutrophil, eosinophil, basophil, lymphocyte, monocyte, macrophage, erythrocyte, and these are platelets. So this is like an animated picture. I'm gonna use one of these for this video. Probably one of these might be better. Just with circulating blood cells. I think it's going to be more about the organs, because when you know clearly what organs you're focusing on, because like blood forming organs are not particularly apparent. You don't look at someone and say like, oh, look at your bone, it's making, blood cells. But then you think like, oh, if you connect it like there's the bone marrow, there's the spleen, and there's the thymus. And then you see it's not just bone, it's not just spleen, it's not just thymus. And they're all working together. And that's what's nice about hematology. Because they're connected, and yet they're so distinct from each other.